As you know, muscle tone in everything we do physically and surgically can be really, really important, particularly for a person who's just carried a child for 9 months. Their body's been through a lot, their normal activities have been interrupted, and after you've given birth, had your child and recovered, to get your muscle tone back is incredibly important. Unfortunately, we can't help a whole lot with that. Most of that is done on your own, with your own hard work, good exercise, and good diet. However, a lot of women will notice that during that period, they have a really difficult time getting some of the tone back in their abdomen in particular. They'll tell you, I'm really watching my diet, I'm doing all my exercises, but my abdomen just doesn't seem to get toned. And it's important for them to understand that that's probably not their fault. For a lot of people, particularly after one or more pregnancies, they will develop some laxity of the abdominal wall. It's called a rectus diastasis. It's when the tissue between the abdominal muscles gets stretched out a little bit. Obviously because there's been a child in there and it's really large and it stretches the body out. And no matter how hard a lady works, she's going to have a really hard time getting that abdomen back into pre-childbirth condition because that tissue's been stretched out, and exercise does not help with that. Some women, you'll say that didn't happen to them. That's absolutely true, but the majority of women will have that area stretched out somewhat, and that's where we can help. When we talk to patients about abdominoplasties, oftentimes we'll talk to them about tightening up that abdominal wall, bringing those muscles back together, and once we do that, they can really take off with their own muscle tone, their exercise, their abdomen becomes more flat as it was before surgery. So if you've had a child and you're having a hard time getting that tone back in your abdomen, it might be worth having us take a look and see if maybe we can help.